This is a video to try to help describe what surgeons are looking for when we reformat according to the scaphoid. So if someone requests scaphoid views, 2D MPRs of the scaphoid, what do? Well, this is how we normally will acquire images. Usually it's some oblique plane because of the patient's hand position is not perfectly aligned on the table. You get these sort of oblique axial images, which by the way are flipped. We'd prefer these to be so that this is displayed up here and this side is displayed down here. But anyway, as you're looking at the wrist and joints in general, we like to reformat images according to the joint we're looking at. So in a normal wrist, this is not the scaphoid alone. In the normal wrist, we would probably tilt this and cone in so that the images would be aligned according to the axis of the wrist and not to the tabletop position. And similarly on a sagittal image, it might be something like that. And then you'd get true coronal, sagittal, and axial images. But for the scaphoid has an unusual configuration. It's this structure here. It's sort of comma shaped and it's angled, and surgeons are looking for the morphology of the bone itself to determine if something is healing properly or if there are fractures. So what you want to do is you want to align the image plane according to the long axis of the scaphoid on both the coronal and sagittal images. So just look at this. This is what I said was the normal routine wrist position. If I look at the sagittal images through the scaphoid, I only see a part of the scaphoid on this image, and as I scroll out, I see the distal pole here, and I see the proximal pole down there, but I don't ever see it all on one image. And that's what the surgeons are looking for. So what you do is you align your best you can. It's gonna vary depending on the wrist position at the time of imaging, but you want to make your sort of, let's say, sagittal oblique plane. You can prescribe it off of these coronal images basically along the long axis of the scaphoid. So now if you look at how the sagittal images look here, or let's say when you put them in the final image up here, you can see that the line goes through the long axis of the scaphoid, and now you can see the scaphoid all in one image, a nice contour, and they're going to evaluate sort of the shape of this on the sagittal image. That's what they're looking for. I like to sometimes also oblique these images on the sagittal so that that's also kind of along the long axis of the scaphoid. And now you really get a true picture of how the scaphoid looks. That's what they're looking for when they ask for dedicated scaphoid images, and that's what we've been including on our routine CTs of the wrist.